According to your staff report, the county invited representatives of all the bargaining units to participate in part of an insurance committee to review the draft request for proposals for alternate health care providers. And there was no representation for the retired employees. The question that I have is, I guess we're not recognized as an official or active retiree group, so what is the process? What's the process for the retiree group to be involved and to be recognized as an official group? And so what I would like to know is if the board could request, what I'd like to request the board to do is to delay any action today in order that the represented retiree group could participate in the process, so that we would have the opportunity to review the RFP proposals to help make that decision that will affect all of us. I feel for the employees here and the state of affairs that you're in, but I hope that you'll give us the opportunity to participate. Thank you.
We won't be making a decision today. This is just for, I'm sorry, my mic. Today is just for us to receive information and for the public to give us information. But a decision will have to be made, soon in the first part of August. And I don't know what the process is, but I am aware that there has to be an official association for retirees. So maybe if they could contact our administration office to get information, or our HR department to see how that can be established, and then they can be participants.
Mm-hmm. Do you have any comments?
Well, it's going to be, most likely it's going to be part of the retirees to form that, and legal probably can define that a little bit more, but we can obviously guide and direct them.
Right, we can give them some general information, but it's somewhat equivalent to the county forming a union for the employees. It's not our job. It's not what we do. If the retired members want to form an association, that's up to them, and they can form whatever association they want. Again, the county can encourage that or say, great, when you form the association, we'll be happy to talk with you. They don't have any legal standing as a bargaining unit under the MMBA or whatever, but informally the board can still talk to them and take into account whatever their wishes are. But they're not a formal bargaining group like SEIU or.
Sure.
Okay, thank you.
And thanks for that information.
Thank you.
Mr. Chairman, we had two more speaker cards, Catherine Shaw and Pat Lowe. I don't see either one of them here. Oh, Pat, did you have one?
No, I didn't put a card in.
Okay. And Elsie wanted to speak. I couldn't find your card, but Elsie wanted to speak as well. So those are the only cards I have.
It's good to see all of you. Thank you. Now don't yell at us, okay?
Pardon me? What was that?
I said don't yell at us, okay?
Oh, okay, never. I'm the one on your side, too. Okay, it's good to see you all. Good afternoon. I found out, just kind of by word of mouth, what was happening on Friday afternoon. And I was like, oh no, I can't believe this is happening and nobody knows about it as far as the retirees. Nobody knew anything about it. There's over 200 retirees receiving health insurance benefits in this county. And none of us were notified about anything that was going on. Well, and then Margie brought up possibly having some kind of group. We're not talking about any kind of bargaining group, but maybe being part of the insurance committee, if that's a possibility. And I'll further delve into who I need to about establishing that. CalPERS, I'm all for staying with CalPERS personally. I have worked for the county for 27 years, and all those years I belonged to CalPERS. There were a couple times when things were pretty hairy due to rising costs and changes in benefit levels, et cetera, and somehow we got through it. One of the things I like about CalPERS is that they don't take into account catastrophic illnesses. And being that I was in HR for 8 years and I worked with FMLA, I worked with a lot of employees that had really serious medical conditions, a lot. Whether it was cancer, some kind of tragedy, heart disease, et cetera, et cetera. So keep in mind that those utilization costs, when we're looking at reestablishing premium levels, those will be looked at. And I know that there's different levels, but they will be taken into account. One chemotherapy treatment runs about $9,000. And I knew someone personally who went through chemo treatment, and because of her insurance, she had to go to San Mateo County to get treatment. And I don't want to see any of that ever happen to any of our employees or retirees, for that matter. Also, about a year ago, when the insurance increased so drastically, I actually have family coverage. I have a disabled son who's 31 that I'm responsible for, and my husband and I. So I went from paying whatever 200 and something to that $750. So what did I do? I had to go get a part-time job. So after being retired for 2.5 years, I went and worked part-time. But I was insistent on keeping my coverage, and I did whatever I can. Now, employees are working full-time, and they're not going to go out and find another part-time job, or maybe they will, but somehow in the past year they have found a way to pay it. And not that I'm not sympathetic, because I'm in that boat too. I had to figure out a way. How am I going to pay for this insurance? I need it. I have to have it. And all of you are probably going to retire from the county at some point too, so you really need to think about this as well. You're going to want this health insurance coverage. When I came to work for the county 27 years ago, that was something that was really, really important to me back then, and is more important to me than ever now. So really consider not leaving CalPERS at this juncture in time anyway. Okay? Thank you.
I was going to, then you got up, so you beat me to it.
Good afternoon, Marty Richmond. So I have some ideas. Maybe I don't have a horse in this race, and I'm reluctant to trying to tell somebody who's going to use the health insurance what health insurance they should have, or how much they should have to pay, because I don't know their personal financial situation, and everybody's different. But I do have some ideas that might help, and I, as a background for another reason, I just had done a financial analysis of several hospitals. I don't know if you guys knew it or not. One of the folks, and this is not against them, I'm just saying there's more involved here. One of the folks said Anthem is one of their network. You knew that Anthem walked out of the San Benito Healthcare District, right? Everybody knows that. So, it's not even here. It used to be here, but it's not here. They would rather pay 3 times as much to Salinas Valley than 1/3 as much to us. But here's the idea I have. First of all, I don't think you should be trying to bargain with every bargaining unit. What I think you ought to do is have the bargaining units form a committee that has the authority to vote for the bargaining units. And I think they should come up with the retirees either as part of the committee, that's up to them, or the retirees as a adjunct to the committee to advise them of what they would like. And I think the bargaining units as a whole should come up with a recommendation so that, they won't get 100% everybody vote for the same thing, but you guys get that every time. You get 3-2 votes all the time, rather than trying to make every bargaining unit happy. And the reason is they can talk to each other, they can say things to each other that they can't or don't want to say to you. And they can do it in private, and they can argue out why they should want this coverage or why they should want that coverage, and people who can come with their personal experiences and say, this is what happened to me. I know people who took chemotherapy. I know this, I know that. Those are important things when it comes to health care. So I think what you ought to do is, and you can't do that before your deadlines, and that's the other problem which is, I call it the San Benito problem. We walk in here all the time going, okay, this has to be out of here by next week. And it's a decision that takes really 8 months to make, even if you don't know what the rates are. So I'm talking next time, because I don't know what you're going to do this time. That's up to you guys. But it would be tragic to make a mistake this time and make the same mistake next time, because you don't deserve to be punished twice. So I think you ought to ask the bargaining unions if they're willing to do that. If they're willing to sit down and bargain with each other, give their own committee the right to pick what they want. And then you have to start early by offering early options. So you have to have the information early so that they can make the decision on what they would have. And I think it may not give you a perfect answer, because there is no perfect answer in today's world of the price never goes up. But at least you'll get an overall feeling that they've had a contribution to the decision and some satisfaction of making the decision they wanted. Thank you for your time.
No more speaker cards.
Okay, anyone else wishing to speak on this item? Now's the time to do so.
To the board president, board members, and attendees. My name is Keith Brown. I'm with Keenan and Associates, and I just want to say a couple of things. There are a couple of questions in the earlier session and during lunch I just wanted to clear up. Number one, what happens to retirees? For the pre-65 retirees under Keenan and under the PACE plan, the pre-65 retirees get the exact same benefits as the active employees, so they get the same rates and the same benefits. For the post-65 Medicare retirees, the pool has a Medicare exchange platform where the Medicare retirees will have more options, Humana, Pacificare. And as I had a conversation with some folks outside, what we do is we assign each Medicare retiree a benefit consultant such as myself to find out which providers you're using, which prescription drugs you're using, and we try to find the right plan for you with the lowest amount of copays and out-of-pocket costs. So the Medicare folks in our pool pay an average of $240 per month for their premiums, and you can contrast that with what you're paying currently under CalPERS. There was a question about referrals to surgical centers either in Stanford or outside the state. Our network is the Blue Cross Pruitt-Beyer network, which is the same network you use under CalPERS, PERS Care, and PERS Choice. We don't offer a select network because that's a carved out network. It's a smaller network, and we don't want to limit the providers our members have. We use the most expansive Blue Cross network. So any of our plans you choose, you can use any Blue Cross provider. We don't have a narrow network plan. Rate increases. There was questions about what happens after the first year. There was talk about 7.5%. In our pool, everybody gets the same rate increase. So when you come in, after we've already presented rates for the first year. Year two, you will get the same increase that everybody else gets. We don't regionally rate folks. We don't penalize folks that are in Monterey versus San Benito. Our folks in San Mateo, Santa Clara, San Francisco, they get the same +1, +2, +3 as you will get. And our average rate increase for the last 5 years has been 3.2%. You can compare that to what you have currently with PERS. Lastly, I'll just say that bigger is not always better. I mean, our competitor got up and said we're twice as big as Keenan. Well, if bigger was better, you probably wouldn't be looking at leaving CalPERS because they're the largest. Now, if in 15 years they've taken 2 groups out of PERS. In 5 years, we've taken 5 groups out of PERS, and we have 6 more coming out this year. Thank you so much. Didn't mean to talk so fast, but I had lots of notes, and we appreciate the time.
Thank you for your comments.
No other cards.
Okay, see no other speakers. I'll bring it back to the board. I know that it's been brought to my attention by staff that we will be having a special meeting on this. Most likely that meeting is going to be held on August 15th. All right?
We're checking, so we'll get back. We'll get back to you. Yeah, we'll get back to you on that.
Okay,
Well,
yeah.
by the end of the
but
day,
in all likelihood, we will be
having a
most
special.
likely having a special meeting.
We're gonna probably need to. We'd like to have all the board present, so I think it'd be good to have all the board present. And I think on the 15th that would be a possibility, depending on timing. So that's I think the item that George is going to look into right now is we need to turn in the decision of the county by Monday the 15th. Is that regular business hours, or can that be in the evening? If we have an evening meeting, then that may be a problem. So I'm not sure. We still don't know. So we'll come back to you.
Okay. But
Yeah.
either way, if we need to get it done prior
Yeah.
to the 5 p.m. deadline or whatever, we'll definitely get that done.
Okay.
So, okay.
Yeah, sounds good.
All right. Any other comments from members of the board on this issue? Comments or questions? Supervisor Batella?
Yeah, I have a comment. We're all, as Elsie stated, we're all in the same boat. We have the health insurance, administration has it, and most importantly, our staff has it, the employees. And there's there's a lot of people that are struggling making ends meet, and we recognize that. We really do. And healthcare has been an issue for a long time in this country, and a lot of people kind of put a lightning rod on the American Care Act. It goes far before that. I ran a business, still am in business. Now my labor force comes from contractors that have to deal with health care for their employees, and I pay that bill. But one of the things that had a dramatic impact on my business when I was packing apples and shipping them and running 2 shifts in a packing shed and a harvest crew out in the field. I had around 75 people working for me, was workers' comp. And that had, flexibility in the rates that were dramatic from one provider to the next. And, the only way that to lower those costs is to go out and see what else is available. And that's what the board and the committee has been working very, very hard to do for the last, I don't know how many months. And it's accumulating right now. And I certainly appreciate the input from our bargaining units and the willingness to look at other options that will put money back into the pocket of our employees. I am concerned as one supervisor of the lack of information getting out to the people that it's affecting, and I hope that we're due and work hard to get more information out between now and our special meeting, and some of the questions could be answered to bring all of us closer together as far as making a decision for the future. And I urge our staff and our committees to work, and our union leaders to do the best they can. I think we absolutely need to convey information to the retirees. Probably no health plan is perfect. I know I have CalPERS, and I mentioned that I utilized it a few years ago. I had a medical procedure at Stanford, and I sat there, and there was a treatment that I needed or could take that would ease some pain, but it was an expensive shot, and CalPERS turned it down. And so those things that happen with any plan that you have, I think. Let's see. But I certainly want to move forward with the confidence that we have the majority of our employees behind us. And if that means if we could get our act together, get that information, get to that special meeting on the 15th, do what we need to do, I'm going to be a lot more fine with it if everybody is a little bit more supportive than what I'm seeing right now. Either that, or we try to go and reboot it for next year. But I really do believe that we would not make a mistake leaving CalPERS. But that's me personally. I'm working for all of you too. Thank you.
Thank you, Supervisor. Any other comments at this time? Yeah, and, this is certainly a difficult a decision that we have as a board, and certainly we'll be spending the afternoon, I know, in closed session working with staff to try to come to some kind of agreement or a decision, and then obviously we'll work through our staff to schedule that special meeting.
Yeah, so I just got word. It is 5 o'clock. That's a deadline, so we need to meet either 9 o'clock, 10 o'clock.
So in all likelihood, special meeting will be about 9 o'clock.
9 o'clock on the 15th.
All right.
Okay.
Okay. Okay. It looks like this time we'll be moving on. Okay, so let's move on to item 27.
Mr. Chair?
Yes. You have to come up to the podium.
While she's coming up, is that a for sure 9 o'clock on the 15th? Or are we still working that out?
No, it has to be before 5 o'clock.
Oh, I
so
understand
whatever the board wishes, if they want to meet at 9, if the calendars are okay with 9 o'clock, 9 o'clock will be the time. So 9 a.m. on
Monday,
the
on
15th of August.
15th.
Yeah.
Okay.
I just wanted to ask Marjorie Appel, just wanted to ask about the meeting on the 9th that was scheduled for the decision to be made. Is what's happening with that meeting?
So
and
the decision will be made on the 15th.
So you're postponing it, and there's no way to get it before then so that we can have a little more discussion on it?
No, we will.
So we will be meeting with the group again. So we'll invite the retirees, and then we'll invite 1 or 2 people, and then you can disseminate that to the rest of the retirees. If you
that is
wouldn't
through
mind.
the insurance.
For the insurance meeting, we can at least invite them to that meeting. I think would be prudent on our part to do that.
Okay.
Yeah.
Thank you.
All right. Okay, let's move on. We'll move to item 27, which is through the child support services.
Good afternoon, Mr. Chair, members of the board. Jamie Murray, Regional Director, Child Support Services. August is Child Support Awareness Month, and we appreciate the opportunity to present this to your board and appreciate the opportunity to have you recognize us. I'd like to introduce Alicia Cardenas. She's my branch manager here in San Benito, and she'd like to share some information with you about our program and some of the activities that she has planned for Child Support Awareness Month.
Excellent.
Hi, good afternoon. And good afternoon, Mr. Chair and members of the board. My name is Alicia Cardenas, and I'm the branch manager at the San Benito County Department of Child Support Services. Every August, there's a national celebration of Child Support Awareness Month, which is aimed at educating the public about the importance of child support and the work of child support professionals. So I'm here today to tell you a little bit about our program and to request that you proclaim August as Child Support Awareness Month here in San Benito County. The Child Support Program was first developed through federal legislation in 1975. The San Benito County Department of Child Support Services became a standalone department in 2001, initially staffing over 32 employees. In 2002, the San Benito County Department of Child Support Services regionalized with the Santa Cruz Department of Child Support. Since 2007, the department has reduced its staffing to numbers due to multiple factors. Focusing on increased performance and in customer service, the State Department of Child Support Services provides us with many resources, and they also collect our performance data and report to the federal government. In federal fiscal year 2014-15, with an average of only 20 staff on board, San Benito County's overall performance achievements surpassed all other years in the department's history. In support orders established, we reported in at 95.11%. In collections on current child support collected, we reported at 69.80%. In collections on cases with arrears owed, which means that there's past due support owed on those cases, we collected at 69.79%. Our cost effectiveness was at $2.74, which means for every dollar that our program costs, we collected $2.74 for families in this county. Our total collections last year was $4.7 million. We are now approaching the end of this federal fiscal year for 2015-16, and the performance forecast is also great. This year, the department has already reached a new all-time high in percentages of court orders established. That is at 96.01%, and it means that more children and families have court-ordered child support. Now that you have heard a little bit about our history and the recent achievements, I'll tell you about the local outreach we do. When we go out into the public to provide education, we not only provide information about our services and some of the other local services provided by partners in our county, but we also are able to establish a rapport with parents and by caregivers to children in this county. And thereby that increases the compliance with the support orders, and it decreases the accumulation of child support arrearages. Our staff goes to the local jail and we talk to inmates about the child support program. We assist them with child support paperwork and we answer questions. We also go to the juvenile hall here in San Benito County, and we provide education to young adults about the costs associated with raising children, and we talk to them about making good choices. Each semester, our staff does a presentation to juniors and seniors at the San Andreas High School, as well as at the Pinnacle School on Southside Road. This June, we staffed an educational booth at the Hollister Farmers Market for the first time ever. So since August is Child Support Awareness Month, we've come up with an additional set of activities in order to promote the theme of this year's campaign. And the theme of this year's campaign is support. Your support shapes their future. Jamie has the state's poster.
It's one of our outreach materials that we'll be using.
So your local child support office will be sharing this message all month long by running a child support ad at Premier Cinemas at the movie theaters here in Hollister. We also have a booth. We'll have a booth at the local National Night Out event, and that's going to be downtown on August 2nd. In collaboration with Monterey County and Santa Cruz County, we're staffing a child support booth at the Vets Stand Down at Fort Ord, and that's taking place during the weekend of August 19th. And lastly, we'll be staffing a child support information table across the street at the new courthouse during one full week of August. So thank you for taking the time this afternoon to receive this report, and if there are any questions, I can entertain those now. If not,
Members of the board? Nope.
But I'll make a motion, Mr. Chair, to approve the proclamation.
Second, Mr. Chairman.
Motion second. All those in favor?
Aye.
Aye.
Thank you.
You
And
can stay there, please.
I would just like to also acknowledge some of the child support staff that have worked diligently all year to improve our performance measures, and they do a really excellent job. I'm really proud of all of them.
Well, thank you. It is my pleasure to present you this. Our chair has appointed me this privilege, and children don't have a voice, but we're their voice. And so I really appreciate what we do as a county, what you do as an agency. And parents create them, but don't always take care of them. So this is really good. So I'm going to read just a couple of these. Proclamation, Child Support Awareness Month. Whereas Child Support Awareness Month celebrates the important emotional and financial parental support that can create a brighter future for our children, helping them to become healthy, productive, and well-adjusted adults. So therefore, be it resolved and proclaimed that the San Benito County Board of Supervisors do hereby recognize the month of August 2016 as Child Support Awareness Month and commends the San Benito County Department of Child Support Services for its steadfast commitment to improving the quality of life for the county's children and families by providing timely, accurate, and responsive child support services. So thank you for your success, and thank you for taking care of our children.
Thank you very much.
Okay, so moving on to item 29. This is out of our Resource Management Agency. Mr. Barnes?
Mr. Chair,
Yes.
I feel embarrassed to say that I pulled the wrong recon contract earlier. This is the one that I actually need to recuse myself for, so I will recuse myself again.
We should do it for the whole day.
You should just say you're the owner of Rincon.
So, Mr. Chairman, this is, good afternoon.
Good afternoon.
This is on the regular agenda as opposed to the consent agenda, only so that Supervisor Munzer could recuse himself. We knew we need to do that. I want to point out that the description here is a little bit convoluted, and I want to clear that up for you. The environmental work for Rincon is proposed at $91,198. There is an additional optional task for Hexagon traffic that is $30,774. That would make the total contract with the option of the traffic work, but not without the contingency, at $121,972, just so that's clear. This is for environmental work for a project behind the Ridgemark development. I'd be happy to answer any questions.
Any questions for Mr. Barnes?
Mr. Chair, real simple question. That's the one with the road going to Southside Road, right?
Yes, sir.
Thank you. Got it. Thank you.
Any other questions?
And that's just
At this time, I'll open up to members of the public.
work with the current contract.
Oh, I'm sorry. It is Mr. Richmond.
Okay.
You did. I apologize, Mr. Richmond. It looked like a 8. That's fine. But you were on.
Louis has a new job and he already cut me out of he no longer has to put up with me. Thank you.
He discovered.
By the way, congratulations on your new job. I hope it includes a raise.
It does not.
Okay. I wanted to talk about the traffic portion. I want to make sure that we have not only a consultant but enough staff to evaluate the traffic on this, and that they coordinate closely with the city, look at stuff that's already approved but not built, and look at stuff that's already sitting in the Planning Commission, like all that stuff along Union Road. Basically, what's going to happen here is you're going to have the world's worst traffic jam, and no one's going to accuse me of being anti-development. It's just a fact of life. You've got this entire enormous increase in the amount of housing there, and it all is fed by 3 roads. It's going to be fed by Union Road, and it's going to be fed by Fairview Road, and it's going to be fed by Airline Highway. And all those come together, almost come together, exactly together, one's down the road a mile, at the same place. And you've got what's left of Santana Ranch going up. You've got all these proposals of west of Fairview, north of Fairview, south of Fairview, whatever they call it, across the street. You've got the guys who rode on the back of the college who want to go in there. You've got the big, huge proposal for a bunch of McMansions behind Silla Vista. You've got the Bluffs thing here. You got stuff dumping into Southside Road and all that stuff along Union Road going down. And let me tell you, a study will not move one single car any faster. What it's going to take is a commitment to increase the vehicle handling capacity on those 3 roads. And that is going to be a fortune. There's no other word for it. We all know that. We got the traffic impact report. We know what it's going to cost. And we've got to figure out a way to pay for it. And we've got to figure out a way to get it in as the houses are built. Or one day you're going to wake up and half of your commuters are going to still be here at 9 o'clock in the morning because we will be in total gridlock, especially if they wind up delaying 156 another 2 years, 4 years, 6 years, 8 years. You pick them, okay? And we can wait until they get out 156 and say, you don't like it, call the state. But as long as they're sitting on Union Road, Airline Highway, and Fairview Road, they ain't going to call the state. They're going to call both the city and the county, and with good purpose. You won't be able to do this unless you're adequately staffed in resource management for this, public works, whatever, whoever it needs to be, but it got to be somebody. And it won't be some person who also has to handle all the other development issues, whoever that is. They won't be able to do all the environment, everything, all the collection and impact fees, everything. You need somebody who can really concentrate on the public works portion. So I encourage you And, you know, I understand our problem because we're running out of money and we're running out of time on everything. But we've got to get somebody in Public Works at the level of experience that they can do this. Otherwise, you won't have any chance at all. You won't even be able to get a good reason why you couldn't do it. So I appreciate your time.
Okay, anyone else wishing to address the board on this issue? See now, I'll bring it back to the board for a decision.
Yes, Mr. Chair. Yeah, I don't disagree with anything that was just said by the public speaker. And we just got to keep working and coordinating with the city as far as traffic circulation. But going into the future, there's no question about it. Traffic is going to be not a good thing. It's already a disaster. And we haven't seen any growth. But that was good advice. But I'll go ahead and move towards staff recommendation.
Second.
Okay, all those in favor?
Aye.
Aye.
Opposed? Motion carries 4-0. Okay, moving on to item 30, Resource Management Agency again, Mr. Barnes.
Good afternoon again. As you know, we've been upping our level of effort in integrated waste management, and working through contract issues and performance issues and reporting issues and so on. Excuse me.
Thank you.
And as a part of that, we've had on board CSG consultants who have given us very good advice with regard to both the contract and the permitting requirements going forward and so on. We're looking today to increase their role in integrated waste management because we believe that it's an investment in the future and that we will be able to more than recover the cost of the contract fee over the next couple of years as we move through a series of conversations with Waste Connections and other providers. Excuse me. So I'd like to point out one thing and then introduce CSG staff. The subject line, the subject part of your staff report there calls out the contract cost as $23,403. My apologies, there's a decimal missing. The contract amount is $234,030 with a 10% contingency of $23,403. I believe it's correct in the resolution in the contract itself, but I wanted to point out that error. And I'm delighted to bring to you Kathleen Gallagher of CSG, who has worked closely with us. And she has a couple of her staff members here to introduce as well. And I think that you'll be very impressed with their qualifications and their approach to the work. Kathleen?
Thank you. Good afternoon. It's nice to hear the word delighted and solid waste and recycling sort of in the same sentence. As Brent said, the county's integrated waste management program has several requirements that you're all familiar with, but I'm just going to briefly talk about those and the complexity of the state requirements that have been placed on our jurisdictions. The several requirements that need that specialized technical support is not only AB 939, which is that Integrated Waste Management Act that was passed in 1989 that requires us as all jurisdictions to meet a 50% diversion from landfill. There's also additional mandates that have been handed down to us recently, AB 341, which mandates commercial recycling, as well as provides a statewide target of 75% diversion from landfill. Additional requirements are AB 1826, that's regarding commercial organics diversion from landfill. AB 1594, that does not allow diversion credit for organics that are used as alternative daily cover. That's the material that goes on top of the landfill. And then there's additional requirements that are legislative required on our jurisdictions. Needless to say, we need to provide compliance and reporting to the state's department, CalRecycle, on this. So as you can see, requirements on solid waste, landfill, recycling, the numbers not only increased, but it's growing in complexity. So just a quick walk down history lane, again, regarding garbage and recycling. So as you might recall, the board approved the county as the lead agency for the county's integrated waste management regional agency. And they did that in 1995 by approving a joint powers agreement. And within that, the county, the cities of Hollister and San Juan Bautista are the regional agency members. And the purpose of that regional agency was to jointly meet the requirements of AB 939 and subsequent legislation. It's also important to note that in 2007, regarding that joint powers agreement, the county also approved a cost-sharing agreement. Again, that was in 2007, and it defined very specific projects about what the county was supposed to do as the lead agency. Those include providing the personnel, providing the projects, the program costs to meet AB 939. I'm not going to bore you with the details, but there's 11 specific tasks that are on that cost-sharing agreement. The highlights are to implement programs to meet the AB 939 and subsequent legislation, to manage the landfill agreement and compliance and ensure that our operator is Waste Connections is doing the job that they're supposed to do and the revenue that we're supposed to be getting from the county happens. Household hazardous waste collection programs, residential and commercial franchise agreement management, as well as the procurement process. You might recall that the Recology agreement for our franchise hauler is up in June of 2018. We are supposed to manage our non-franchised haulers, RJR, San Benito County, a lot of our non-franchised haulers that are operating in the county. Additional integrated waste management budget, our grants, our public education. It's a very substantial list. The good news is on the cost-sharing agreement, what it did is it also stated that the county is supposed to be reimbursed by the city of Hollister and San Juan Bautista for the work that we complete as the regional agency. And the way that calculation reads in the cost-sharing agreement is it's based on a population. So for City of Hollister, it's 64% to be reimbursed by the regional agency, 3% by San Juan Bautista, and then of course ours is the 33%. So as you might recall, landfills, solid waste, I'm very interested in these. I've been operating in recycling and garbage since 1989, when the first statewide requirements happened in the state. And I've been providing solid waste staff report, particularly regarding the landfill agreement, and providing recommendations to our ad hoc committee. I've had the great pleasure of working with Supervisor Munzer, Supervisor Barrios, and the great pleasure of meeting individually with the board members. So per Brent's direction, I did prepare technical support scope of work that you have in your agenda packet to meet the integrated waste management requirements. When I did read those, they are significant. So that amendment lists all of the project tasks, the hours to meet those requirements. Brent asked that I did meet, that I bring our team members that'll help out on this project. And I'm happy to say that we have some very skilled folks that work in our company, CSG. I was happy to see that these folks were actually available for this particular project because there is a wide scope of work. So one of our first team members is Kevin McCarthy. He has over 24 years of waste and recycling management experience, not only in the public sector, but in the private sector. I think that's really going to be valuable for us as we work with Waste Connections and Recology. He has a strong record of completing several complex projects to provide cost-effective recycling and solid waste. And he worked very strong, really closely with the haulers for collection and processing services, facility operations. He's got a long list of financial analysis, experience, contract negotiations, and policy development. He had experience at 11 years as working as the executive director of the South Bayside Waste Management Authority, which is comprised of 11 jurisdictions in San Mateo County. So Kevin's going to be working on and assisting in terms of the landfill projects, the solid waste and recycling procurement project, and a report that has a very near-term deadline that we are needing to complete to the state as quickly as we can, which is called the Cal Recycle Summary Plan. We also have Parmajit Upal, who has 27 years of program management and extensive experience in budget and finance and rates. She is our spreadsheet guru. She's going to be our valuable asset to working with our IWM requirements for our cost-sharing agreement related to accounting, budget, a lot of the revenues that are coming in from the non-franchised haulers, et cetera. We also have Lisa Ochoa, who's not here today, and she has over 19 years of experience related to landfills and other solid waste facilities, and she's going to be assisting us also on the landfill projects. So per the direction from Brent and from the meetings I've had, going forward, I would be providing monthly updates to him in terms of progress indicators, milestones that we've met, and other additional near-term projects. We've got a number of deadlines that are coming up very quickly. So that is the very brief synopsis of our integrated waste management technical support. I'm happy to answer any questions you might have.
Are there any questions,
Mr. Chair?
Supervisor De La Cruz?
Let me get to the first one. AB 939, which is a 50% diversion program.
Right.
Can you help me out here? Right now, the landfill operator is taking waste. How is the landfill operator going to meet that 50% if they're just taking waste?
Sure. The way that the state mandates that we calculate our diversion rate is by the waste that only our regional agency disposes.
So locally?
So just our waste, which historically has been in the neighborhood of about 50,000 tons.
50,000.
So that is in 2015 and 2014, 2013. That's about the level of tonnage that's been coming in that we own. And what I mean by own is us, the regional agency.
So how much is coming out of our San Benito County?
So how much is coming?
What's percentage on a daily basis?
As our regional agency is approximately 51,000 tons. That's what was disposed in 2015.
We give them a permit for 1,000 tons per day.
Right. So what you're referring to, I believe, is the out-of-county tons that are coming in.
What's the percentage of out-of-county going into the
80% in 2015.
So the state wants us to do the 50% of the other 20%.
No, yes.
Okay.
Of only what we own.
Right. So what we own, 20%. So let's say it's 10%. It is so insignificant knowing that 80% will be coming out of the county that we have no control over.
And the jurisdictions that are bringing that tonnage, County of Santa Clara, other counties that are bringing it in, they have their own requirements to meet that AB 939. So we're not responsible for the tonnage that's going into John Smith that's coming in from other counties. What we're concerned about is our regional agency, are we meeting our state mandates, and are we doing it cost effectively?
Got it. No, you made a reference to the Recology contract, which is up in 18 months from now forward. Isn't it behoove us to actually start working and start developing language now versus waiting 4 months before the contract ends?
It's June of 2018.
Right.
Absolutely. Because the current franchise agreement, the way it's written, there's a number of things. I've finished 2 projects regarding procurement for other jurisdictions. Our staff has got extensive experience in requests for proposals. Definitely, because there's a number of things that we can improve upon in our current franchise agreement in terms of cost-effective programs. We need to meet some additional mandates that the state has put toward us. So absolutely, in the near term, and I think a lot of it involves understanding where our deficiencies are. What are some of the things that we need to improve on?
Okay. All right. Good. Thank you, Mr. Chairman.
Okay. Supervisor Batella?
Yeah. Where have you been all my life? I really, the couple of times that I've met you. gotta bring some light to this meeting. You have proven that you've got such a high level of expertise, and that's kind of what I mean. I'm a married man, of course. But I'm very, very pleased that we're entering into this contract with you, and I wish we could have done this a few years back, that's for sure. But, what concerns me, the state keeps passing these regulations, and what I see is people just taking their loads of garbage and dumping it in the unincorporated areas and secluded canyons and things like that. And the only way you incentivize people to comply with this, because it's a come down to the people, it's not the landfill, is to raise the rate so high that you can't afford to take your garbage to a responsible place, which is really too bad. I just had to say that, but I'm very much in favor of bringing yourself and your team on board, and look forward to the
thank you so much. I appreciate that. We're very motivated to be to provide as Brent said, bringing in additional revenue from the landfill. All of those things we're looking forward to, and so thank you so much for those comments.
Supervisor Munzer?
Thank you, Mr. Chair. So since Supervisor Patello went down the road he went down. Brent, have you assigned a desk to Catherine yet? And does that desk have a chain that we can attach to her ankle?
No, but I know the sheriff, so.
Thank you, Mr. Chair.
Thank you,
Supervisor
Mr. Chair.
Barrios.
I want to thank you, Kathleen. That motivation that you have, you're so motivated has really passed on to the committee, because there's an awareness of where we needed to go, and we need to do that. Is it a high-ticket item? Absolutely. But I think at the end of this whole process, San Benito County is going to benefit immensely in the way of diversion, in the way of additional fees, in the way of meeting being compliant with the state of California and the ordinances, because I read where those ordinances, we certainly don't have the staffing to do that. That is a job in itself. Yeah. So those ordinances are going to come before us so we can approve them at a future date. I think so anyway, with that being said, I really want to move forward on this as soon as possible. But my only concern is that this is 1 year. This is a lot of work to do in 1 year, but you do have dedicated staff that is going to concentrate on getting this done for us. I'm just hoping that we don't have to exceed that timeline and that it becomes more costly on down the road, because it is, like I said, a big ticket item for us. So that's my comment and my question, I guess, thrown into one.
Mr. Chairman, in fairness, Kathleen and I have talked about this as an interim solution, and handing this back over to staff. I agree with you that this is a lot of work for 1 year, and it's likely that we will come back and ask for a short extension nearer the end of this year, but I don't want this to go on forever. We want to have RMA staff take this back over, but we want to get a landfill operation, an integrated waste management operation that is up and functioning when it comes back to us, and so that's largely what this is about.
Okay, thank you,
Supervisor Dela Cruz.
Thank you. And my final thought or question to this is that I've always voted no on anything that comes to the Board of Supervisors when it came to a rate increase. I just felt that we just weren't getting the better deal of it, and my fellow Board of Supervisors can testament to that. But on top of Supervisor Barrios' question, I really want to see a progress report of what are you going to be doing here. Because, yes, you need to turn off fires right now. Totally agree with that, and you can comply with the ABs. I understand all that stuff. But at the same time, once this department is settled, I honestly see an environmental student out of San Jose State or some other university coming in and taking on some of that routine work, such as the reportings from Eagle Recycling, RJR Recycling. I've even asked questions to Brent and said, I need to know what these numbers are. How much are they paying fees? What's the tonnage? Can we do an independent audit on any single company that's out there that's doing business in San Benito County? And I kept getting the answer, no. or we'll get back to you. So I'm glad you're on board, but at the same time, I'm cautious the cost that we're paying. And I know that 64% the city's going to pay for, and 3% San Juan Bautista, and we the other 33. But it's worth the investment today, knowing that in the long there's an exit plan for your organization and allowed local staff to be trained well and take over that program and not get to the mess we are today.
Thank you.
Okay, at this time, I'll open up for some comments from the public.
I'm always available as a member of the public. I really hate to break up this version of The Bachelorette, but I will come in here and say something important. Since I live in the city and I'm paying 64%, if we're not getting any benefit from the 80% of the trash that goes in there, I don't want to pay that portion that supports that. So as far as I know, we're not. Maybe you can enlighten me when I'm finished here in my measly 3 minutes. It would be unfair if you guys are getting all the benefit from the 80% of the trash that comes in from the outside, for us to pay 64% of the charges to get that straightened out, that portion straightened out. Obviously, the portion that has to deal with us needs to be straightened out, and I understand it's a joint effort and it's jointly owned, but are we getting a joint benefit is the question. What's the benefit to the city? I mean, I always wanted to live in the trash capital of the world, so I can't tell you how glad I am that the only going business we have here is taking tons and tons and tons of trash. It hasn't served us well, I don't think, at all. You guys walked away with $4.8 million, and I'm not going to let you forget it. And now you want the city perhaps to pay 64% of the bill to figure out what the heck we can do with the $4.8 million. I don't think it's fair. I will be talking to the city council and saying we should pay our fair share. I always want to pay our fair share. But our fair share does not include money you put in your pocket that's not shared with the rest of the JPA. If we have a joint agreement and we want to make sure we get, so I'd like my 64% of the $4.8 million to go to the city where the ratepayers were. I think that's fair, and I don't think it's fair that you sold portions of the landfill to get that money in your hand. Thank you for your time.
Okay, is there any other members of the public wish to comment on this item? Seeing none, I'll bring it back to the board for further discussion or decision.
Mr. Chair, I make a motion that we approve amendment number 3 to the contract with CSJ Consultants.
Second.
There's a motion and a second. All those in favor?
Aye.
Opposed? Motion carries 5-0. Move to our final item of the day, item 31, out of Health and Human Services Agency.
All right. So let me just pull this up. Today, we're presenting revised program requirements and budget for the County General Assistance Program. We need to have you adopt the resolution repealing number 2014-27 and establishing a new General Assistance Standard of Aid and adopting revised General Assistance Program policies and procedures. So I have hopefully a brief PowerPoint for you today. So here's what we're going to try to cover today. Revising the standards, prioritizing the CWSD 12-month rental assistance program, working with Section 8 vouchers with the Housing Authority, and we've had several conversations with them on that. Deducting housing and/or housing and utilities for general assistance who are receiving in-kind housing. This is something that has been adopted in other counties. We had talked about deducting housing and general assistance participants for those who are homeless, but we've been advised by council that there is case law that keeps us from moving in that direction. We want to continue to assist general assistance participants to qualify for federal benefits. We want to continue to work with local developers and RMA on low-income housing units. And to the extent that it's feasible, we want to try to coordinate work programs with other departments. There's a lot of kind of complications to that particular proposal. And again, continue to work with mental health on treatment programs. Legal requirements, general assistance are found in Welfare and Institutions Code 17,000. Says every city and county shall relieve and support, et cetera, all incompetent, poor, indigent persons who are not otherwise covered by some other program. That's basically what it says. It also says in there that the board may adopt a general assistance standard of aid that meets this section of the law. And if you adopt that general assistance standard of aid, that adoption shall constitute a sufficient standard of aid. That was passed back in, I think, 1991, 92. So what we're presenting to you today is a standard of aid that meets that definition that you can adopt. Just a brief history of general assistance in San Benito County. Basically, prior to 2013, the county maintained a non-defined general assistance program. In 2012, you were notified of a potential lawsuit. You revised the general assistance programs in 2014, and therefore no suit was filed. In June, we were requested to review the program requirements and cost of the 2014 adopted general assistance program, and today we're presenting to you the results of that. So the components of general assistance that we're presenting today, just to kind of go over it again: standard of aid, rental assistance program, working on Section 8 vouchers, in-kind housing utilities reductions, continuing to work with clients to get benefits, low-income housing, work training and participation programs, and mental health and substance abuse programs. This is a comparison of the current standard of aid with the recommended 2016-17 standard of aid. Keep in mind, we went back and we reviewed all of this to be sure that the recommended 16-17 standard of aid that we're proposing is consistent with the state law. And so our calculation is based upon that. Okay, so we're certain that if you adopt this standard of aid, it meets the provision of the law that says this is okay to do. The rental assistance program, when we met on this, the Community Services and Workforce Development Division said to us, we have a rental assistance program whereby if you refer general assistance people to us who need rental assistance and they qualify, which they will, we can prioritize that general assistance population, and this will stabilize and pay housing and utilities for up to 12 months. This works really well with people who already have housing, and there's a number of them that do. It works less well with people who don't have housing because, as we know, housing is difficult to come by in San Benito County, particularly low-income housing. But we needed a plan for those who would use up their 12 months under rental assistance. So we talked with the Housing Authority, and we've had several discussions with them. And we've presented this to the Homeless Planning Committee. We can coordinate with the Housing Authority to prioritize our Section 8 voucher list so that those people who are defined as meeting certain definitions, basically those narrow definitions that would say this is a general assistance person, or this is a homeless person, can move to the top of the list. This has been done in Santa Cruz County. And it, depending upon the direction we take on this could take up to 90 days to kind of get it into place. But the Housing Authority has said they will work with us to get this done.
Mr. Chair?
Yes.
Mr. De La Cruz?
Jim, trying to say the right words. You know what the waiting list is for Section 8?
The waiting list right now is about 4,000 people.
Years, time.
Oh, a couple of years. But if we prioritize our list, we know that from talking with the Housing Authority that there's 4 or 5 vouchers that come open every month. And if our list is prioritized and basically general assistance people are defined as a group that needs to have that priority, they will move to the top of the list.
But isn't, maybe I'm answering my own question, but isn't anyone who gets on the list for Section 8 is automatically qualified for general assistance?
No.
No?
No.
Well, okay, that's my issue right there. My issue is that you're going to have someone who submits an application today.
Right.
And they have to wait 2-3 years.
Right.
2 years, I think you're too generous, in my opinion.
Right.
According to the people that I know who submitted applications for Section 8. So all of a sudden, tomorrow, someone who's under general assistance applies for Section 8 and just, boom, automatically go top of the list.
That's correct.
I just have a little concern about that.
Okay. I think those are things that we will bring back to the board once we have developed a proposal for the Housing Authority and ask you to discuss it and make decisions
Because
about it.
anybody who applies for Section 8 and qualifies for Section 8 is in need of help.
Yes,
So we're creating 2 different classes within this group,
that's correct.
and I have a concern with that.
That's permissible. Okay, so it will be, eventually a policy decision for the board to say that that's what they would like to do. Now, what they explain to us is they don't take those 4 or 5 and give it out. They kind of say, okay, we can do 1 or 2 on general assistance and the other 2 or 3
Now,
for the
people on
list.
disability
Yeah.
that don't qualify, that are not under the general assistance, will they also be bumped out too?
Depending on how you define it, in Santa Cruz County, I believe they defined it as those who have medical needs and low-income needs. So a lot of that definition, we're going to have to work it out with the Housing Authority. We can send out to you if you want, and the policy that's been adopted
You're
by.
asking me to make a decision between someone with 2 kids and a homeless person.
I am,
That's what you're asking me.
yes.
Mr. Chair, if I could, because I attended that meeting and we've been communicating on this. It is going to be up to this board to determine the priority list. And we can look at others, like the one in Santa Cruz, but we really will be up to us as to how we want to divvy up that list. And yes, you're right, Supervisor De La Cruz, you will have to decide, but if we don't do that, the people with the greatest need could still end up at the bottom of the list. This way, if we deem some people more in need than others, then they can come up to the top. And I know that they're out there. There may be a family that, yes, maybe they have 2 children, but they live with a family, a family member, and they have a roof over their heads. And there may be another family that maybe have no children, but that have medical needs and are out in the street. So it's we got to weigh it, and we have to do at the end of the day what we feel is going to be best for the most need. So, thank you.
And when we're ready to move forward on this item, we'll bring the director of the Housing Authority in, to talk to you about how things work on their side. But again, Santa Cruz County has gone through this conversation and has adopted a policy that gives priority to low-income groups that have, in their view, higher needs. Okay? In-kind housing and utilities deductions. So basically what happens here is if somebody's eligible for general assistance and you adopt a standard of $331, and the housing and utility portion of that is $269, they don't get the $269, they only get what they need for personal and incidental expenses. This will reduce the costs of the program for us. They can also then be referred to a rental assistance program, but basically if they're getting free housing, we don't think we should be paying for their housing. We'll continue to work with the Social Security Administration on disability benefits for people. If people get SSI and have been on general assistance, we have agreements in place with Social Security Administration that we will be reimbursed out of the first check that goes to that person because it's a retroactive check for what we have paid out. If they get Social Security disability benefits, they don't have a provision for that, and so we just have to rely upon people agreeing to work with us on that.
Mr. Chair, Jim, sometimes Social Security takes about 6 months to 18 months for someone to see their first paycheck. Is that something you can continue to finance, knowing that Social Security will
Yes.
send the money?
They'll pay it back to the date that they applied. All right? And it actually takes 2 to 3 years. Okay? Sometimes. Low-income housing. We want to continue to work with our local developers on creation of low-income housing units. One of the things we know is that it's just really hard to find an inexpensive place to live in San Benito County. We're continuing to track the new legislation, No Place Like Home, and we're hoping that as we learn how that's going to roll out, that we'll be able to do that. There is an 8% set aside in that legislation for small rural counties.
Is that 8% of what we get total, or is 8% of the total?
8% of $2 billion
Right.
set aside for small counties. Work training and participation programs. We really wanted to try to do this, but as we looked into it, there are restrictions that make it kind of difficult to do. So what we're asking you to do today is to adopt language that says, to the extent that it's administratively feasible, we will work with public agencies to implement work and training and participation programs. And we will be sure that if we work with those agencies, that it meets the concerns of human resources, supplying labor resources, training and safety, supervision and costs and so forth. Basically, if you adopt a standard of $331 and somebody gets $331, they basically can work about 30 hours a month. If they're one of those people that is not getting their housing and they're only getting $94 a month, they can only work 9 hours a month. We think that, amongst other things, creates just kind of some operational problems for organizations like RMA. So we're not against looking at it, but we want you to basically say to us, to the extent that it's administratively feasible, we will work on that.
So, thank you, Mr. Chairman. So basically, the assistance person is going down and getting a check.
Right.
But they're expected to provide something for that money.
Yes.
That's big. I'm happy you just said that, because
Yes.
a lot of people say, well, they just go down there, get a check, and then.
No. There are currently requirements in your general assistance handbook that there are things they have to do, and if they don't do those things, they are discontinued from aid.
Perfect. Thank you.
Okay. Mental health and substance abuse treatment. We coordinate with behavioral health. We've done that. That has actually worked, pretty well. They are restricted by the fact that their programs are voluntary, so we can't tell somebody you have to go get that, but we can say to them, you know, as part of what you're doing with us, you know, you need to at least make your appointments and things like that. And we'll continue to do that. So here's the proposed 16-17 general assistance budget, which we have revised in the last few weeks. Based upon these standards, if you adopt, you know, what we're proposing today, and we look at our current caseload, and we assume that our current caseload is going to be about on the average of what it is right now, maybe go up or down a little bit. Our best estimate is that the county general fund portion of general assistance for 16-17, if everything happens the way, you know, we're projecting, will be $134,269, which is a reduction from $280,000. Tracy?
No, it was more in it was in the 400 range.
Yeah.
It was in the 400 range, if I remember right.
So it's a reduction from where we are. And it's a reduction because we're asking you to put in place things that will help us to manage to that number. So we're asking you to adopt and revise the standards of aid to reflect housing, utilities, and personal expenses, to adopt the new general assistance handbook, and to make it effective September 1, 2016. And the reason it's September 1, 2016 is we're under legal obligation to notify people that these things are going to happen to them. And that's our recommendations for you today.
Mr. Chair, if I may add a couple comments. So I want to first thank Jim and his staff for working on this. This item came to light, as you recall, on slide number 4 in June of 2016. That was when we met with Health and Human Services to review the budget for general assistance, and it was at a very low number a few years back. I believe it was about 20,000 or so, and escalated up to about 200 last year, and then it was escalating to about 400. So I requested Jim to address that and to look at other options. So his staff, Tracy, and I know Enrique and many other members of his staff worked on this to look at other options to reduce the general fund obligation, and that was really kind of the big caveat with that. So that was kind of what stemmed this, and also to your board a few years back actually asked to receive an update, kind of a status of where we're at, and if we can make any modifications to the general assistance. So that's why we're here today. Thanks, Jim.
Okay. Are there any questions from members of the board or staff?
Mr. Chair.
Or Del Cruz?
Thank you. I think this is a wonderful program. However, because it's going to change the structure of the Section 8, I cannot support this program.
Okay. Any other questions? Supervisor Munzer?
Thank you, Mr. Chair. Jim, I don't want you to have to go back to it, but one of your first slides, you talked about the city and the county both having to have a plan in place.
Says every county and every city and county. City and county is San Francisco.
Oh, I see. So in other words, it's our responsibility in this community here. It's a county responsibility.
Yes.
And the way that's worded, it's covering San Francisco.
That's correct.
Okay, gotcha. Thank you.
Supervisor Batalla?
Yeah, I guess I have a question. All else fails, so we have to. The way I read this, we're on a deadline with this to support it to maintain, being in compliance. And I understand where Supervisor De La Cruz is coming from because of the changes in the Section 8. He doesn't want to, and correct me if I'm wrong, Supervisor De La Cruz, choose between a mother that has 2 children that's living in an apartment
with
to somebody
relative,
that might
like
be a homeless person. Yeah. And I share that compassion. I would side with the mother with the 2 kids, but way I'm understanding is that that part of it's still come back to us to discuss, as far as what the criteria would be, as far as those changes in the housing component.
Right. You're not adopting that as part of your general assistance program today. After we talked with the Housing Authority and we put something together that we think might work, we'll then bring that back to you and you'll adopt it at that point in time.
So there will be Mr. Chair, sorry, I apologize, Mr. Chair. So that will be an opportunity for me to voice my opinion
Yes, sir.
on. So for now, it's a policy.
Yeah, for now, we're basically in discussion with the Housing Authority. We're not asking you to adopt anything about that today.
Okay, all
We'll
right.
come back to you with that.
Okay.
We think that
Okay.
we've done the best job we can to revise the program and revise the budget for you, and we hope that that can go forward.
Mr. Chair, as long as I'm given another time and opportunity to express my opinion about the positioning of the Section 8, I'm okay with that then. Thank you, Supervisor Botello.
This time I'll open up to members of the public. Questions or comments? Seeing none, I'll bring it back to the board for a decision.
I will make a motion, Mr. Chair, to adopt per staff recommendation.
Is there a second?
Second.
Okay, motion is second. All those in favor?
Aye.
Aye.
Opposed? Motion carries 5-0. Mr. Clerk, so at this time,
Thank you.
I'll,
Thank you.
it looks like we're going to reconvene back in the closed session. All right.
That was when we're getting all together to vote
For Cox,
Yeah,
Mr.
for
Cox?
Cox.
Yeah.